Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and let's talk about picking the right scanner for your office. You're thinking about maybe doing clear aligners, or maybe you're starting a new office and you're like, hey, which scanner should I get? Little do most people know, they try to pick the cheapest one, but that can really impact what you can do in your practice. So it's a very important decision to make, and I caution you not to just go with the cheapest. So first thing, if you're doing this with the goal of only doing clear aligners primarily, I'm assuming you use it for restorative too, but you got to keep all that in mind. If you're thinking about doing implants or profs, it's going to be a different choice. So I'm only going to speak to clear aligners. If you want to talk about doing it for profs or restorative, you should definitely talk to someone in that space and weigh it in. So I'm only going to speak from the ortho standpoint. That's all, because that's all I know, right? So I can tell you in our offices, we have an iTero, we own 2 iTeros, and then in another office, we have a Medit. So we have chosen not to mix match. So if it's an office that has an iTero, it gets Invisalign. If it's an office that has Medit, it's not going to do Invisalign. So anyway, so that's pretty much how that works. The reason why I'm bringing this up, even though I have a lot of other content on this historically in my channel, and you can go into I think I even have a scanner playlist somewhere. It's not very popular, but I believe I have one. You can look at all the historical content, but this is probably what's most updated as of 2025. Always new things coming out, right? So first thing I want you to do is I want you to look up $28 million lawsuit, dentist. Maybe add a liner to it. I'm not sure. I'm not going to give you the brand. You can look at the news articles on that. So it's pretty amazing. So my old content, and that's why I want to clarify this, said, you know what? As long as it's not a bait and switch, it's fine, because that's the way we were trained. We were always told, as long as you don't bait and switch. If you have all over your website Invisalign, and you come in and you only offer ClearCorrect, that's a problem. Okay, can't do that. Or you only offer your own brand of aligners, and there has been orthodontists and dentists who've gotten in trouble for that. Okay, I get that. That seems fair. But what if you were offering both Invisalign and clear aligners? And what if you I've seen plenty of, because I look at people's websites all the time, because when I know they schedule a call with me, I go look at their website and I see what they're offering. And I say, oh, they offer this and that. So, and I'm like, oh, they offer 2 brands of aligners. I would say it's quite common for people to offer both Invisalign and another brand of aligners. Why? Well, it's cheaper. And you know what? To be honest, if it's a simple case, sometimes it's cheaper to use another brand. Also, not even just money. I'm talking about picking the right brand for the case. There are plenty of patients out there that will come in and say, I want to do aligners, but I refuse to do Invisalign. People say that all the time. They just don't. They see the brand as kind of omnipresent. And you guys, hey, if Align Technology is listening, because I know they listen to all my stuff, I'm not disparaging you at all. I'm saying what patients tell me, okay? Patients tell me stuff. Doctors tell me stuff. I'm just repeating what people have told me. There are plenty of patients who dislike Invisalign. They just dislike big business, big brands. They like the idea of an off brand. They think they're getting a better deal. Whatever, it's psychological. They probably didn't have any bad experience with it. It's just maybe it just seems so popular. Sometimes people like to do something that's less popular. People like the underdog. People are weird, right? So I've definitely had patients, and doctors tell me that patients have said, I refuse to have Invisalign. Sorry. Okay. So what do you do in that situation, right? I like the idea of being able to offer 2 brands. And then also, what if you picked Invisalign, which has a gentle, nice scallop trim, but you have to have a lot of attachments for Invisalign, right? Because of how soft the plastic is, how gentle the plastic is, and also how the trim line is. It needs a lot of handles. Nothing wrong with a handle. You've heard me talk about handles in my videos before. Who cares about handles? I don't really have a problem. As long as you shade match and put them on non-blobby, the handles are great. So, they're really not that visible if they're done right. So I don't think they're a huge deal. Personally, I'd go with the one that's healthy for your gums, that's more comfortable, if that was something that bothered me. But if I was somebody, and I think I've talked to you before, occasionally you find a case that doesn't have a lot of root correction, torque, extrusions, and you don't necessarily need a handle on the front teeth as long as you had a pretty good trim line. And if you want to know more about trim lines, you can look at my content on that. I have a playlist just for Invisalign, a playlist just for white label clear aligners, a playlist for off-brand clear aligners. So I kind of divided it like that. White label means no brand, things that you do in your house, in your own office. Not that popular now as it was before. But in any case, yeah. There's so much information you can get out there, but sometimes you can, if there's someone who's so anti-attachments, I would definitely choose a different brand over Invisalign. I'm sorry. It's just better. For that particular patient. So, but Invisalign in this Oh, I didn't want to say the brand. Okay, anyways, read the articles when you see them. They're all different viewpoints. It's just journalism. I didn't write them. I am not saying them either, but you can see what happened, okay? So ultimately, what we got out of this lawsuit is that you cannot offer two brands. A certain company is not going to like it if you offer two brands. If you offer two brands, not just a bait and switch. If your whole website is using the term Invisalign for clear aligners and not the word clear aligner, okay? That's a problem. If you're using that as a marketing on your SEO, because think about it right there. I mean, Invisalign is a powerful marketing tool. It's SEO, right? So if you don't have Invisalign in all over your website and your social media and stuff, and somebody and some random patient, prospective patient, is like looking for a doctor near me, doctor near me, comma, they're not going to put in clear aligner. They're going to put in Invisalign. Just like people, when they want facial tissue, they ask for Kleenex. That's just how it is, right? Kleenex is Kleenex. I say pass the Kleenex. It might not be Kleenex brand. Invisalign is Invisalign. They're the first one to market. They're the brand name. That's how that is. Okay. Plenty of different companies like that, right? I mean, you call it a Zyn, but it might be an off-brand nicotine tablet. I mean, you get the idea, right? So that is why this is a problem now, because this changes the whole game. Now you have to go back, because in the United States, if you have a different scanner, the vast majority of scanners cannot be used with Invisalign. They'll take a few, but I think it might only be iTero and maybe one other. I can't remember. You guys got to look at the current thing. In other countries is different, but it's kind of scary because you're kind of like pigeonholed into basically Invisalign, or you can't ever do Invisalign, unless you find another scan center, but then you can't have any marketing say Invisalign. So what's the point, right? So you either got to change all your marketing and also social media to clear aligner. And you guys don't hold me on this because this is just what I'm reading in all the blogs. If I put all my social media and when I talk to patients about it, I say clear aligner, clear aligner. We have two brands of clear aligners. One is a branded, one is an off branded. I believe that is okay. Of course, call Align Technology and run that by them, but that is my understanding that is okay. But you can never call it Invisalign in any of your marketing website explanators, when you sell the case, when you explain it has to be called a clear aligner. So hassle, right? So then you lose the benefit, which is why I kind of go back and I go, I don't know. I feel like the brand Invisalign just has so much more power. Why not just do it, But then again, if you're going to be using the scanner for other things besides aligners, you might not want to Invisalign. So the iTero. So anyways, just things to think about it, trying not to complicate it. Definitely check out my website. And you guys, I'm not loyal in any way to any particular brand. I really do not care. As long as it moves teeth, and predictably, and we get outcomes as expected, assuming the patient was compliant and the doctor did a good job on the Clincheck. If I look at a Clincheck and it's trash, well then, okay, it wasn't the aligners company. It was your fault for not knowing how to navigate a Clincheck, right? But if I look at the Clincheck and it's awesome, and I'm like, that should work. Now let's see your tracking photos. Okay, well, he's clearly tracking. I'm looking at all your virtual check. You got to have tracking photos. You don't have tracking photos, then you cannot assign blame because you did not monitor compliance properly. That's how you monitor compliance. If you don't have that, you didn't monitor compliance. So if tracking is on and the Clincheck looks right, and you get a funky outcome unless there's pathology, yeah, that's the aligner company. And if it keeps happening, then that should be a bell in your head that something is wrong with that aligner company. Now, do I see that happening with Invisalign? No. Do I see that happen with ClearCorrect? Not usually. It's much, much better than it used to be. So do I see that happen with other aligner companies? Yep. And I'm not going to tell you which ones because I don't want to get sued. So, all right. Thanks so much.